Hi Brian, how are you today?
I'm fine, how are you?
Good. So I understand you're having some vision issues and
Yes.
that's kind of affecting walking around and doing things around the house and cooking and things like brushing your teeth and issues at work as well.
Correct.
Okay, so today I'm going to do a few assessments so that I can kind of see where you are and what's going on with your vision. And then I'll tell you kind of what we're going to be doing next time when you come back as far as some activities and treatments that we're going to do to work on that. Does
Okay.
that sound good?
Yes.
Okay. So the first thing I want to do with you is I just kind of want to see how you walk.
Okay.
We're not going to walk very far, but I just want to see how you move and if you're kind of looking around as you're walking. So we can start over here. And I'm just going to, we can walk this way. I'm just going to hold on to you just in case. But as you walk, kind of just tell me, I'll cue you, but tell me what's to the left of you and what's to the right of you, okay?
Okay.
Okay, and what's over to your left?
I don't know.
Okay. Okay, and we can just do a little U-turn and go back to the chair. Okay, so I noticed that you were kind of holding on to the wall as you were walking.
Yes.
Is that something that happens at home when you're walking around?
Sometimes.
Okay, so what we're going to do next time is we're going to try and kind of get away from having to hold on to things as we walk, and I'm also going to put things up for you to look at while you're walking so that that can prevent any trip hazards in the future, and you can get used to kind of looking around as you're walking. Does that sound good?
Yeah.
Okay. So the next thing I want to do is just kind of see how clearly you're able to see. I'm going to stand back here with this. You've probably seen this at the eye doctor, but it's the smell chart. And you just tell me kind of how far you're able to read and how when the words start to get a little bit blurry, okay?
Okay. E F P
Mm-hmm.
T Q N.
Okay. Is this pretty blurry?
I can't see that.
Okay. Okay, so I know with work, and I know you work with your cell phone a lot, I'm going to kind of show you some ways that you can adapt things that you work on every day. So your computer and your iPad and your cell phone, I'm going to show you different ways that you can make the font bigger and kind of dim the screen so that you can see things more clearly. So we'll address that next time as well.
Okay.
So now I'm going to just test your pupils and how they adjust to light. So I'm just going to shine a light into kind of the side of your eye and just see how well you're able to adjust the light being shined in there. Okay, I'm going to test this side. Okay. So it looks like your pupils are not adjusting as well with some of the lighting. Have you noticed kind of when you're working at the office or at home,
Yes.
it's extra bright? So I'm going to also talk to you about different ways that you can kind of dim the lighting and adjust the lighting in your home and at work. Again, there's also a way to do that on your computer as well, so that by the end of the day you don't have those headaches and it's a little bit more comfortable for you while you're working and doing other things at home. Okay. Now I'm just going to see if you have any issues with double vision or kind of overshooting when you're reaching for something. So I'm going to hold this pen up, and I want you to just reach out and try to grab it, okay? Okay. Okay. How about here? Maybe a little bit closer. Okay, so that I know will probably be difficult when you're like working in the kitchen and trying to reach for something in the cabinet. So we're going to set up some activities to work on that, and I'm going to help you adjust that so that you're able to reach for those items in there when you're cooking and that kind of thing. All right, so we just have a few more things to do. I'm going to test your field of vision, okay? So I'm going to have you cover one eye. I'll start with your left eye. So if you could cover that. And I'll cover, yeah, you're using the paper, sorry. All right, and you just tell me when you can see the pen coming into your vision, okay?
Okay. 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 Okay.
Okay, let's do the other eye.
Okay. Okay. Okay.
Okay, good. Thank you. Okay, so I noticed that with your left eye, and I noticed this when you were walking too, that you're not really looking to that side as much. So what we're going to do is I'm going to kind of have to help you actually use it and almost like force your vision to be used on that side.
Okay.
So we're going to do that with an activity. I'm going to have you cover your favored side, so your right side, and I'll leave a little bit of that vision so that you can see, but we're going to cover most of it so that you have to use this side, okay? And I'm
Okay.
going to place things over here for you to reach for so that we can get that side more involved. Does that sound good?
Yeah.
Okay. All right. Now I'm going to ask you to look at two pens, and I'm going to say the color of the pen. So I'll say pink, and you look at the pink pen, and when I say blue, you look at the blue pen, okay? I just want to see how fast your eyes can switch from one to the other, okay? So pink, blue, okay, pink, blue, okay. So I noticed that that was a little bit delayed going from one to the other, and I'm sure that probably makes it difficult to kind of find things in a busy environment, and I know it's probably difficult to look at a document at work and then to the computer. So I'm going to help you next time on ways that you can organize your work environment, and then I know finding medicine or silverware in a drawer is going to be difficult, so I'll also help you with adaptive ways to make that a little bit easier so that you can organize those things, okay? All right, and what I'm going to have you do now is just, you're going to follow the tip of the pen and just keep following the pen. It's going to get closer to your nose, okay? And then try and follow it as best as you can. Okay, it's a little difficult. And you were saying that you do have trouble with things like brushing your teeth.
Yes.
That's kind of difficult. Okay, so that's something we're going to address. I'm going to help you make it a little bit easier for your aim as far as getting the toothbrush to your mouth so that it's not as messy of a activity for you. Okay, we're almost there. Now I'm just going to have you, I want to see how your eyes move. So again, if you could follow this pen, but we're going to go in more of like a rainbow motion, okay? So just follow that. Good. Okay. Okay, so you're having a little bit of issues with that, and this can be kind of difficult if you're having issues with that. It might be kind of tough to go down steps. You said you had a few stories or a few steps leading into your house.
Yes.
So we're going to set up some activities where we can practice that and work on different ways that you can do that safely so that you don't fall or anything like that in the future.
Okay.
All right, so now what I'm going to have you do is, this is just a piece of paper with a little exercise on it, and I just want you to, if you could try reading from there, and then if you can't read it from there, just show me where it's clear to you, like where you have to hold it in order for it to be clear.
This technique
Okay.
is performed by sitting on a chair, eyes closed, and a palm placed gently over each eye.
Okay, so you had to hold that a little bit closer in order to focus on that. There's a lot of different adaptive things that we can use for that as well. So when you're at work, there's kind of like a little magnifying glass thing that you can put across your paper,
Oh, okay.
so that it makes that writing or typing a little bit clearer. But we'll work on that. We'll do some activities where you have to read kind of larger letters on the board, and then we'll kind of help you, make it a little bit clearer with those magnifying glass things. Okay, so now we're going to do just a couple more things. I'm going to have you follow the pen again. And you're just going to move your eyes and not your head, okay? So just follow the pen. Okay, so I noticed you had a little bit of difficulty with that. So that's probably, is that tough at work when you're having to read things on paper and then going from that to the computer?
Yes.
Okay. Well, I can also help you set up a better work environment so that that's a little bit less difficult for you. We can put things closer together so you don't have to scan as much, and then we'll practice some activities with that as well.
Okay.
All right, so this is the last one. I'm just going to have you, I'm going to write some crosses out on this piece of paper, and if you could just copy the same pattern right underneath. Okay, so having issues with this, you're probably having some, you were saying that buttoning up your shirts, that was kind of difficult. Yes. Okay, so that's something that we'll address. We'll practice with buttoning up shirts that you have to wear to work and that kind of thing, making sure that you can align things properly so that that won't be as difficult. So we will work on all of these things over the next few visits. Does that sound like something you'd like to do? Did you have any questions?
No, not at this time.
All right, thank you.
You're welcome.